Alright, this test is the pain provocation test for the shoulder. The scientific explanation for this technique is this test is used to detect the presence of a tear of the superior glenoid labrum in an anterior to posterior direction, often referred to as a slap tear lesion. The glenoid labrum is a ring of fibrocartilage and dense fibrous collagen that is attached to the rim of the glenoid cavity and encircles the entire glenoid cavity, increasing its depth by 50% while also making this cavity more concave. According to the American Academy of Orthopedic Surgeons, slap tears are a common injury to the glenoid labrum and involve a tear in the superior portion of the labrum on both the anterior and posterior side of the long head of the biceps brachii insertion on the supraglenoid tubercle. The pain provocation test for a slap lesion I'm about to demonstrate is a provocative test, which means the determination of whether the test is positive or not is based off the patient's subjective rating of their pain. This test was developed by Memoria et al. In 1999 and reported an initial sensitivity of 100% and specificity of 90%. To explain this technique in layman's terms, I would do it as follows. This technique is used to see if the cuff that helps keep your shoulder in place is intact or whether there is a disruption in the top part of it. This test is positive or negative based on whether or not there is pain in your shoulder when it is placed in two different positions. In order to perform this test, the arm is brought up to the side until the shoulder is at a 90-degree angle to the ground, while the arm is bent to 90 degrees at the elbow and pulled toward the examiner until resistance is felt. Initially, the patient's palm should be facing toward their ear. Once here, ask the patient how much pain they are in. Then move the patient's hand while staying in the same position with the shoulder and elbow until their palm is facing away from their ear, and ask them again to rate their pain. The test is positive if the patient only had pain with their palm facing away from their ear, or if they had more pain when their palm was facing away from their ear compared to when their palm was facing their ear. First step of this technique is to have the patient sitting at the edge of a treatment table, and as a therapist you want to be behind the patient on the involved side. Next, the clinician is going to take the patient's shoulder, place the involved shoulder at 90 degrees of abduction and towards but not to full range of external rotation. The forearm is then put in maximal supination, and you ask the patient to report their pain. Are you having any pain with this position?
No.
All right. Next, the therapist is going to maximally pronate the patient's forearm and again ask them if they have any pain.
Yes.
Do you have any pain? Yes. This test is considered positive for a slap lesion if the patient only has pain when the forearm is in the pronated position, or if the patient's pain is more severe in the pronated position compared to the supinated position. Now I will perform the technique. Do you have any pain?
No.
Could you rate it on a scale of 0 to 10 for me?
0.
Do you have any pain?
Yes.
Would you rate it on a scale of 0 to 10 for me?
7.
This test is positive for a potential slap lesion.